Thank you so much for inviting me here today. My name is Josh Craddock. I'm a Colorado attorney and a constitutional legal scholar affiliated with the James Wilson Institute, a legal think tank. I'm a graduate of the Harvard Law School and a former clerk on the United States Court of Appeals for the 10th Circuit. I'm also a fifth-generation Coloradan with strong ties to Pueblo. When my ancestors moved to Colorado in the 1880s, they actually settled here in Pueblo, and they're buried in the cemetery just down the road. I'm pleased to offer my testimony today on my own behalf, and not on behalf of any employer or client, about the status of Colorado abortion law and their effect on this community. Many are surprised to learn that Colorado has among the most radical abortion laws in the nation, and indeed in the world. In Colorado, abortion is legal through all 9 months of pregnancy up until the day of birth. Colorado is one of only 7 states without any limits on when an abortion can occur during pregnancy. In fact, Colorado is less protective of unborn life than nearly every other country in the world. Only a handful of countries, including China, North Korea, and Vietnam, allow abortion as late as Colorado. Yet under the 2022 Reproductive Health Equity Act, RHEA, abortion was declared a fundamental right throughout pregnancy, and all legal rights were stripped from unborn children. RHEA effectively made abortion an unregulated industry in Colorado. The so-called Care Clinic here in Pueblo advertises surgical abortions up to 24 weeks of pregnancy. According to the Mayo Clinic, at 24 weeks of pregnancy, when the baby is about 22 weeks old developmentally, the baby's fingerprints have begun to develop, and the mother might feel her hiccup in her womb. Babies born prematurely at this age have actually survived outside the womb. Here's a picture of the baby's face at 6 months, right? 22 weeks old, 24 weeks gestation. You can skip to the next slide. Yet Colorado has no law protecting born alive infants like those who would survive abortions at this stage. No Colorado law clarifies that infants who survive failed abortions are entitled to reasonable measures to save their lives. The Colorado Department of Health is not required to keep records of how many children are born alive after abortions. But in Minnesota, where such record keeping is required, 24 babies were born alive after attempted abortions between 2015 and 2022, according to Minnesota State Health records. That means that in Colorado, a 22-week-old baby born prematurely in the labor and delivery ward that is regulated enjoys all the rights of any other Colorado citizen and will be given the highest standard of care in the NICU. But a 34-week-old child in utero enjoys no such rights at the abortion clinic. And in fact, if she survives a failed abortion, the doctor is under no obligation to provide life-sustaining care. Up in Boulder, abortionist Warren Hearn has offered abortions for the last 50 years, even after 34 weeks of pregnancy. That's 32 weeks of developmental age. At that age, at 32 weeks gestational age, right, from last menstrual period, at 32 weeks, the unborn baby practices breathing and her fingernails are visible. All of her internal organs are developed, her fingers and toes clearly visible. In an article for Slate magazine authored by Dr. Warren Hearn in 2003, Hearn asked in the title of the article, "Did I violate the partial birth abortion ban?" And he described how he performed an abortion on a baby that was 17 weeks gestation. Quote, you can skip to the next slide. "I inserted my forceps into the uterus and applied them to the head of the fetus, which was still alive, since fetal injection is not done at that stage of pregnancy. I closed the forceps, crushing the skull of the fetus, and withdrew the forceps. The fetus, now dead, slid out more or less intact." You can take that down. In 2022, there were 487 abortions at 21 weeks gestation or later in Colorado, well past the time when babies can feel pain, which is a disturbing increase of 186% from 2021. That's according to self-reported data from clinics, which they're not required to provide, but they voluntarily provide. There's no oversight or audit of those numbers, but those are the numbers given by the clinics themselves. Abortions in Colorado may also be performed by non-physicians. Under Colorado law, non-physician healthcare providers may perform abortions if they're acting within their professional scope of practice. In fact, according to RIA, there can be no prosecution, punishment, or any other restriction on the individual's absolute right to access abortion. So in theory, anyone could perform an abortion and there would be no prosecution, punishment, or any restriction. Non-physicians, such as nurse practitioners, nurse midwives, and physician's assistants, are also permitted to prescribe abortion pills in the first 10 weeks of pregnancy through telehealth, without even having an in-person consultation. Many abortion businesses, including Planned Parenthood, which Jack Teeter represented, prescribe the abortion pill beyond the 10-week limit as a matter of official policy. And telehealth providers do not always require that the patients be physically located in Colorado during the consultation, allowing for abortion tourism. An in-person consultation would normally involve counseling about alternatives and a discussion of the risks, including the importance of accurate gestational dating, Rh-negative identification and response, and confirmation of a non-ectopic pregnancy. Dispensing abortion pills without an in-person doctor visit also heightens the risk of abortion coercion. It enables abusers and predators to more easily acquire abortion pills, which they can use to pressure mothers to consume or even surreptitiously administer to unsuspecting women. The American College of Obstetricians and Gynecologists reported that in 2007, the prevalence of intimate partner violence was nearly 3 times greater for women seeking an abortion compared with women who are continuing their pregnancies. So these are women who are especially vulnerable. But neither the CDC, nor the Colorado Department of Health, nor the Guttmacher Institute, which is the research wing of Planned Parenthood, record or even report coerced abortions or coerced chemical abortions. Those are not reported or recorded in the FDA's publication of adverse event reports. Women who obtain abortion pills are also denied information in Colorado about abortion pill reversal. Abortion pill reversal is a safe process that allows a woman a chance to continue her pregnancy if she should change her mind after taking the first mifepristone pill. But in 2023, Colorado passed a law prohibiting medical professionals from providing information and access to abortion pill reversal. So much for choice. The law also bans medical professionals from even advertising abortion pill reversal. Now, because unborn children have no legal rights in Colorado, our law doesn't recognize any injury to an unborn child when he or she is killed by violent criminals. 38 states have fetal homicide laws, but Colorado isn't one of them. In 2018, when Christopher Watts murdered his pregnant wife and 2 toddlers in Frederick, Colorado, he wasn't charged with the death of his unborn child. When lawmakers tried to ensure that prosecutors could charge people like Christopher Watts for killing his own unborn child, Planned Parenthood's Kathy Alderman opposed the bill and called it dangerous. Now, with Amendment 79 on the ballot, late-term abortion would be an unregulated abortion would be enshrined in the Colorado Constitution if it passes. The amendment is so broad that it could actually prohibit Colorado legislature from passing laws in the future to regulate safety or protect unborn children from abortion in any way. And it attempts to restrict local communities from deciding what their policies should be with respect to abortion. It would also have the effect of repealing the existing constitutional ban on state and local funding for abortion. So this would require Colorado taxpayers to fund abortion through Medicaid or state or local government employee health insurance plans. Now, this goes to the last point on, I believe it was Mr. Romero's presentation, where he pointed out that private health insurance wouldn't be covered by Amendment 79. And that's true, but it fails to take into account how Amendment 79 would interact with existing Colorado law. That's because a 2023 law enacted by the legislature, SB 23189, requires large employer health benefit plans issued or renewed on or after January 1st, 2025 to provide coverage for the total cost of abortion without policy deductibles, co-payments, or co-insurance. Individual and small group health benefit plans must also provide this coverage if the HHS confirms that the state's determination that the coverage is not subject to state defrayal pursuant to federal law. So the combination of that 2023 law and the Amendment 79 would effectively require, right? It's still going to require private health insurance plans to cover abortion without any deductible or co-insurance or anything like that. So if Amendment 79 passes, that means that public entities and private entities are going to be paying for abortions at taxpayer expense and without deductibles. Now, in 2022, because of Colorado's radical abortion laws, nearly 30% of abortions in Colorado were performed on non-residents who traveled here from out of state. NPR Colorado actually described it in an article as a surge of travelers seeking abortions here. According to Provisional Colorado Health Department data, again self-reported, about 4,200 patients came to Colorado out of about 14,400 abortions performed. Now, to put that number in perspective, the leading cause of death in Colorado in 2023 was cancer, which killed 8,400 people. If the deaths of unborn children from abortion were counted, surgical abortions would account for nearly the top 2 causes of death, cancer and heart disease combined. The barbaric abortion policy of communist countries like China, North Korea, and Vietnam shouldn't be a model for Pueblo. Under Article 20, Section 6 of the Colorado Constitution, home rule cities like Pueblo are vested with and shall always have all other powers necessary, requisite, or proper for the government and administration of its local and municipal matters. That section grants and confirms the full right to self-government in both local and municipal matters. Now, you heard Jack Teeter say that, well, RIA tries to take some of those rights from Puebloans and to decide what's right for their community. But he was specifically talking about zoning, which is traditionally a local area of concern. But nothing in RIA says that a state or a local ordinance like here in Pueblo could do anything broader than what is permissible under federal law, right? So that's something that's been ignored in this conversation. The people of Pueblo should have a say in what's right for their community, and not just the legislators up in Denver or the abortion industry activists that profit from their abortion and apparently are involved in writing their own regulations. That's unusual for a regulated party. Thank you.
Well, thank you, Mr.
Like here in Pueblo, the people of Pueblo should have a say in what's right for their community, and not just the legislators up in Denver or the abortion industry activists that profit from their abortion and apparently are involved in writing their own regulations. That's unusual for a regulated party. Thank you.